Hello students, I am Dr. Jamuna, Assistant Professor, Department of Psychology, School of Adult Health Science from Salem. Today's topic is schizophrenia. It is a disorder. So we are going to see about the all kind of symptoms, causes and investigations and treatments, about the medications what they can do for the future for in youngsters. So I think almost everybody knows about the schizophrenia. It is like psychotic disorders and bipolar disorders also, it is the same. Say it is one of the thing is schizophrenia. Today we are going to see about that. Schizophrenia is a mental illness that affects a person thinks, feels and behaviors. So it is almost for youngsters. It comes in some disoriented or hallucinations or some behavior changes. If it is in hyper conditions, that is autism. It is not the schizophrenia. So we will see about the all detail about the schizophrenia. It is a chronic and severe psychiatric disorders. It causes people for experience and abnormal reality and as well as real life. This happens. For the people with the schizophrenia may experience hallucination, delusions, disorders, thinking usual behaviors, normal behaviors. When they will think, they will think about somebody is talking to their mind or somebody is telling something. They will, according to that, they will do for some youngsters. That is there in nowadays in generations. So it is estimated for a global level. It is a population. The schizophrenia is a common thing for adolescent and early adult, and as well as if they have the statistic analysis for the government, they have in a 36 years. In that age group people, it's commonly seen more and more. So why we will see that? That is mainly the symptoms. These are the symptoms. Based on the symptoms, it is not diagnosed as a schizophrenia, but you have to go for proper diagnosis. Some people will think about these are the symptoms will be there, that will be the diagnosis. It is not like that. You have to go proper analyzing. Symptoms will be for schizophrenia. It is divided in 3 categories. One is a positive symptoms and negative symptoms and cognitive symptoms. Cognitive in the sense, it is mainly their daily activities. For example, memory, walking, thinking, emotions, these and all it undercomes in the cognitive. In that, if it is having any hyperactive or they are not properly behave, that undercomes in a schizophrenia. So schizophrenia usually we can give the symptoms, analyzing while taking the observing or you can tell the patients to observe that. Some people will say I have the schizophrenia. That is not the schizophrenia exactly. They should have this kind of hallucinations, speech disorders, and somebody will be talking, auditory hallucinations. Somebody will be talking in their ear. They will be telling that you have to do like this, you have to go like this. So that is a way they will be doing and they will behave that. Then visual hallucinations, lack of motivations, aggressive, whatever they will do that, it will be aggressively they will do it. So these are the things will be added in schizophrenia. Causes, why it comes, schizophrenia why it comes, it is exactly we cannot have any proper diagnosis. Only the genetic and environmental neurological factors can be classified in that. Genetic in the sense, the people in the family history, any kind of mental illness that develops for the future generations. Environmental factors, it undercomes stress, then substance abuse and prenatal exposure to the virus or toxins. Maybe if it affects with the brain or some heavy toxins are affected to the neurons, that causes schizophrenia. Neurological factors. Neurological factors in the sense brain abnormalities. It is purely abnormal things, that is in any accidents or neonatal after pregnancy, they will be having some kind of stress and that causes schizophrenia. So diagnosis, how you can diagnose? This doesn't have any proper lab investigations or any images studies cannot be find out. the diagnosis you can go with only certain symptoms and the duration of the symptoms. Based on that you can have the diagnosis. It's mainly for the psychiatric and psychological disorders. So for the medicine for the schizophrenia, so antipsychotic medicines for the primary treatment you can give advice. The work based on that they can go for the blocking the dopamine receptors from the brain. It can reduces the some kind of symptoms, hallucination, delusions, this can be blocked. This has got the some kind of like side effects. Antipsychotic medicines got side effect in the sense one is a weight gaining, drowsiness, the movement disorders will be there. Always they will be feeling sleepy and they will not go for anywhere. They will be inside the room. That may it causes because of medicinal effects, side effects. The treatment, what kind of treatment we can advise for the schizophrenia cases? It is a psychotherapy is there, antipsychotic medicines, primary treatments. Psychotherapy it helps only for the improving their quality of life, and cognitive behavior therapy. Cognitive behavior therapy only the patients cannot do that. Along with the family they can train for the person. The family they should have the support for the person overcome from the schizophrenia. It's mainly for psychiatric therapy. The psychiatric therapy is for the schizophrenia. It helps mainly the quality life, and family therapy also it improves the communications and relationship between the family members. And social skill training it affects only for the learning and interacted with other people in the society. If they will go and talk with somebody, they should behave properly. When they will talk, immediately they should not be brazen. Then coping and living with the schizophrenia. So living with the schizophrenia can challenging, but they may strategy is helps individual managing the symptoms and improve their quality of life. This includes the self-care practice and exercise, healthy eating, as well as finding support from the family and friends. It mainly helps for the mental health for professions. Some misconception about the schizophrenia is there. Still the misconception is going on. Schizophrenia, they will be having different kind of symptoms. They will say that it is a schizophrenia, but it is not like that. The individual schizophrenia will be violent or unpredictable. Sometimes the people, when the fact most individual with the disorders, it's not violent. They can lead and provide the proper quality of life and as well as the supportive treatments. Schizophrenia will be substance abuse. Substance abuse in the sense they will be addiction to something else. So that is what are the things we can see. So commonly the individual will be based on these symptoms, it goes worse and worse. In that time they will be addicted to drugs, alcohol and smoking, etc. It's commonly happen with the youngsters. So schizophrenia with the children and adolescents, this will be very serious mental illness effects for the children and adolescent. It's normally for the 10,000 children, that adolescent will be affected in a recent phenomena. The symptoms for the children's hearing voice somebody else, they will be talking always in a their ear, and delusions, disorganized things and behaviors, their lack of motivations, interesting in a society, and they will speak the language and as well as they will not proper sentence will be explained to the others. They will not speak properly. That is the main symptoms for children's. This will be the early diagnosis and a treatment. It can overcome from the symptoms based on significance importance for the children's life. The violence of schizophrenia, commonly it's a misconception. Individual schizophrenia is more likely for the violent. So it's not much people will not affect with the violent. For small children they will do the some violent in the sense they will be they will not listen, they will not do the things properly, they will do whatever it is they like it. So because they will be hearing that some voice, they will be talking about the somebody else individual, they will be talking to them. So that is a kind of listening the words, they will be doing the activities and behaviors. So that is the main symptoms for schizophrenia, especially for the experience of hallucinations. The important violence will be explained issues, many factors contributed to including the environmental and social factors will be affected. Some people, if it is a severe conditions, schizophrenia, they come suicide. It is a high risk suicide cases in the general population, estimated 5 to 10% of individual schizophrenia can be die or suicide. This risk will be highest in the first few years after diagnosing the associate with the factors. This history, suicide identification, depression, it is due to depression and substance abuse. That is the main reason they will become suicide. The main important things individual schizophrenia will be loved ones in aware from the warning sign and suicides and seek help for the patients. They need for the more care. It is a genetic conditions also. Schizophrenia is one of the genetic conditions. In the genetic schizophrenia, it develops individual in family history in the high risk disorders, studies and identifications of severe genetic variations associated with high risk of schizophrenia. The genetic alone it will not develop, it develop with the environmental factors also. It is one of the main role. What is mean here environmental factors? If we are, which area we are living, that is also one of the reason it causes. Near the factories, near that any other chemical oriented or something like sea area, these and all, it's some kind of genetic changes will be occurred in a body that develops some kind of mental illness. So this is a brain abnormality for schizophrenia. Schizophrenia is a brain abnormality in the sense the different structures, functions compared to the individual without any disorders. When the individuals will be compared to the normal and abnormal, they will be abnormal behaviors. Before I said it is cognitive process. Cognitive process is mainly the memory and as well as emotions. These and all the extra categories will be their daily activities that causes cognitive process defect. Many of the children nowadays, they will not be listening properly, they cannot memorize, they cannot have any kind of like they are in a writing or writing skill or speaking, that will be the affected for more children for because of their food habits, lifestyle. That is one of the main reason. These are the difference included the size of cognitives and some certain brain region, it will be deferred the neurotransmitter activities. The abnormalities may contribute to the development of symptoms that will be hallucination, delusions, and also helps for explaining the medicines and treatments can affect the managing symptoms of schizophrenia. Thank you for my listening classes. Thank you, student.